Ladies and gentlemen, my name is Jefferson Bickerstaff, a final year student of Georgia Perimeter College, Dunwoody campus. Today, I'm here to talk about the topic of overmedication in seniors in America. A recent study by the Journal of the American Geriatrics Society states that almost 1 in 3 seniors is receiving medications deemed potentially inappropriate for older people. There is also the problem of dealing with side effects of prescription medicines. The problem of overmedication, which occurs when a doctor prescribes unnecessary or excessive medication to a patient, is rising to almost epidemic proportions among the elderly. We are talking about 33% of overmedicated seniors in America, which is not a laughing matter because it could be your grandparents, your mother or father, aunt, uncle, or you in that percentage. Nevertheless, I want to bring to your attention the causes, effects, and possible solutions to the problem of overmedication of seniors. The need to prevent overmedication while it can be prevented is crucial and a matter of urgency. Medicines save lives. There is no doubt about that, but few are completely free of risks or side effects. It is true that the more drugs that are taken at the same time, the greater the risk of adverse interactions and potentially devastating side effects, as confirmed by Levister's Andrew and Co. Overmedication as a manifestation of countertransference is what Lavista and his colleagues talked about. They expressed the fact that the elderly are the most vulnerable when it comes to difficulty with medications. Mariam E. Tucker, a columnist in the Washington Post, wrote in a 2001 article that patients are prescribed many different medications, often by different doctors for a succession of conditions or for side effects created by other medications. This phenomenon, by the way, is known in the medical world as polypharmacy. It is a fact that drugs save lives, like I said earlier, but polypharmacy is a growing problem among American seniors. The fact that misuse or overuse of drugs can cause several problems in a patient's health condition cannot be overemphasized. But the thought that the more medication a patient takes is tantamount to better health is a fallacy and is causing more harm than good to many seniors. Physicians, patients, and sometimes caregivers must take the blame in the problem of overmedication. Older people, as we all know, tend to see many different physicians, and often many of these physicians do not know what the others are prescribing, as Andrew Dewsbury, MD, a geriatric medicine specialist at the University of Alabama, points out. 10 to 20% of adults over the age of 65 who go to the hospital do so because of prescription medicines that have been taken improperly. An article on the website of Parent Giving Incorporated cited an 83-year-old grandmother who was hospitalized for an asthma attack. At the hospital, the doctor prescribed steroids for the asthma, which made her blood pressure too high and caused vertigo. So the hospital prescribed a blood pressure medication which made her dizzy. While in the hospital, her ankles began to swell, so she was given a water pill, which in turn caused her level of potassium to bottom out. So the doctors added potassium supplements. To top it all off, she was given a drug to treat osteoporosis, which eventually led to gastric bleeding. The article quoted the grandmother as saying, "I came out sicker than I went in." Sometimes, due to the pain that the elderly endure, they themselves or their own relatives mount pressure on physicians to prescribe medicines that will not only provide temporary relief, but multiple side effects later on. Pharmaceutical companies and drug manufacturers contribute to the problem of overmedicating seniors as well. Due to the continuous deterioration of the human body at old age, the elderly tend to rely heavily on different medications for sustenance. They therefore become victim to the prey of pharmaceutical companies and drug manufacturers. If you observe, recently many of the new advertisements in both print and electronic media for prescription drugs are targeted toward the elderly. However, although older adults are the primary target of such drug ads, these ads may not always be created and developed with the information processing capabilities of the elderly in mind. Most often than not, the side effects that are mentioned in the ads outweigh completely the benefits of the drug itself. Such ads are made so believable, but most people, especially the elderly, fall victim to the enticing claims. Most of these ads end with the phrase, "Ask your doctor if drug X is good for you." The fact is that, ladies and gentlemen, these same doctors are behind the research and development of the drug in question and will prescribe it to their patients, some of whom may not need it. Overmedication can cause several problems to the patient, and some of these problems could be psychiatric side effects. One of the most dangerous aspects of overmedication is its effect on cognition and the mental capacity of seniors. Some overmedicated seniors have been mistakenly diagnosed with depression, dementia, and even Alzheimer's disease. Such was the case of Nancy Burns, whose story was recently featured on CNN after her adult children found her at home stumbling, confused, and incoherent. They took her to the emergency room where doctors thought she had had a stroke. Later, a neurologist diagnosed her with dementia or Alzheimer's. Not content with the decision, her children got a second opinion from the University of Oklahoma's Department of Gerontology, where doctors thought she was overmedicated. This is one of the many results of overmedication. In several cases, there have been fatalities resulting from drug overdose. As Duxbury noted, up to 140,000 seniors die each year because of problems with medications, 3 times the number of people as die from breast or prostate cancer, which are both considered public health emergencies. Despite all the causes and effects of overmedication, as I've mentioned above, there is hope and good news about the alarming numbers of cases in the elderly. If anything at all, overmedication can be prevented. There have been several different schools of thought regarding solutions. Some workable solutions for overmedication include good communication between doctor and patient, knowledge of drug side effects in the elderly, and the brown bag review, that is, doctors or pharmacists screening both prescription and over-the-counter medications of the elderly for appropriate dosages and potential interactions. In every case, the patient and the physician must be vigilant. When a doctor prescribes a medication, the patient must not be afraid to ask the physician if they really need it. Nancy's case underscores the need for patients to always carry their medical history with them. That includes all drugs they are taking, even over-the-counter and supplements, and share it with all health caregivers. It is undeniable that drugs do save lives, but care must be taken not to overdose. The results are devastating for both the patient and family, and we must not continue that. By now, I hope you have seen the disastrous effects of overmedication in the elderly in America. But it is one thing to know the fact that overmedication is a growing problem, but another thing to be proactive. Even though polypharmacy, physicians, the elderly, pharmaceutical companies, and drug manufacturers all contribute to the problem of overmedication, the psychiatric, physical, and sometimes fatal effects should alert all stakeholders to do something about it now. The several workable solutions for overmedication, which include good communication between doctor and patient, knowledge of drug side effects in the elderly, and the brown bag review, should be employed to safeguard our aging parents and grandparents. It is undeniable that drugs do save lives, but the same drugs can destroy or kill if not taken properly. Duxbury clearly pointed out the numbers as he stated the number of medication-related deaths is equivalent to 2 jet planes crashing every day. So what does this mean to you? It means over 200 billion of your tax dollars is spent every year to pay for complications resulting from prescribed medicines. Even if overmedication problem does not concern you at all, I believe you would prefer your tax dollars to be channeled somewhere else more profitable to society. Therefore, it's about time you educate yourself and those around you about the realities and dangers of overmedication of the elderly in this country. So what do you do now? Start today. Thank you very much.